Have you ever heard the term the itch that rashes? Well, that's right, it is a term that refers to eczema. Eczema is a condition that occurs on the skin that tends to be very, very itchy, and the more you scratch it, the worse it gets. In this video, I'm going to talk to you all about the different types of eczema and what products you could be using to help soothe the skin and avoid flares. Hi everyone, I'm Dr. Weinstein. I'm a board-certified dermatologist, and I treat patients with all sorts of skin conditions, including those with eczema. Now let's get started. Eczema is actually a generic name that refers to different types of dermatitis or dermatitis on the skin. This is when the skin becomes red, inflamed, itchy, and the root of the problem is that the skin barrier is compromised. Skin barrier compromise might be due to something that the skin was introduced to that it developed a reaction to. In this case, we call this allergic contact dermatitis. Typically with allergic contact dermatitis, the skin can become blistered, itchy, or rashy in the distribution of where it was exposed to a potential allergen. So think of hairdressers, for example. Hairdressers come into contact with harmful chemicals and dyes day after day, and if they have any sensitivity to any of these ingredients, they can develop chronic hand eczema or hand dermatitis, and that condition is due to repeated exposure of a potential allergen. Other examples of allergic contact dermatitis include exposure to poison ivy and developing blisters in the distribution of your exposure, as well as exposure to common metals like nickels. So many people can't tolerate nickel or costume jewelry and can only wear things like 24-karat gold. Metal allergies are super common, and they are a classic example of allergic contact dermatitis. Switching gears, there's a type of eczema that is more commonly discussed called atopic dermatitis. Now, let me debunk a few myths about atopic dermatitis that you might not have known. So first of all, atopic dermatitis is not contagious. It can appear as red plaques and rashy areas on the skin. Sometimes they become infected, and so there can be an odor associated with them. They can be widespread, but most commonly it can occur on the face, neck, arms, legs, specifically insides of the elbows and behind the knees, and it can also occur on the ankles and feet. In fact, atopic dermatitis affects 28 million Americans of all ages, so it's definitely not a contagious condition. There are genetic, autoimmune, and environmental factors that play a role in the development of this condition. And so if you see somebody who's close to you, or if your kid goes to daycare with somebody who has eczema, don't worry, it's not contagious. Now, speaking of children, atopic dermatitis affects 25% of children and a lesser percentage, about 2 to 3% of adults. So it is more often a condition of childhood and less often seen in adults, but that doesn't mean that adults can't suffer from atopic dermatitis. Now, there's a triad in dermatology that we discussed called having the atopic triad, which means that if you have atopic dermatitis, you're also more likely to have things like asthma and allergies. So if you suffer from asthma, allergies, and have skin issues, then you are considered an atopic person, and treating each of these conditions will help the condition as a whole. Now, another myth I commonly hear about eczema is that it's a disease of childhood, which is entirely not true. In fact, it affects about 25% of children and about 2 to 3% of adults. So certainly it is more common in childhood, but not only a disease of childhood. The third myth, another common thing I hear about eczema, is it's a disease that can be cured. Now, unfortunately, this isn't quite true. We do have very sophisticated medications for severe eczema, and we have a number of steroidal and non-steroidal creams that can treat eczema and help with the conditions. But it really comes down to being able to adopt certain lifestyle changes and implement certain treatment measures to help keep your eczema at bay and live your life with your skin as it is, hopefully not flared, but being able to feel confident about the skin that you're in. So let's go into what things we should use or be thinking about help our eczema-prone skin look and feel the best that it possibly can. So first things first, we're getting into seasonal change. That means that no matter where you live, there are some changes that occur in the fall, and this is something that is pertinent and important to realize throughout the year. So in the fall, the air gets drier and colder, and there's less moisture in the air in the fall and the winter. Now, if you live in an extremely dry climate in the desert, for example, then this is going to apply year-round. But if you live in upstate New York, where I am, at this time of year, it gets very dry. And so people with eczema are going to experience more transepidermal water loss, which means that your skin is not able to hold in that moisture as efficiently and effectively as it should in order to protect that skin barrier. And so everything we do to treat eczema is to protect and nourish and replenish the skin barrier. So I'm gonna lay out a few do's and don'ts for your eczema. So first things first, let's talk about body wash. Washing your body is an essential component of your day-to-day life, right? Let's face it, everybody showers, everybody takes a bath, and so that's something you're gonna do whether you have eczema or not. So when you enter the shower or the bath, it's important to avoid products that contain ingredients like fragrances, retinols, harsh chemical exfoliants, or beaded exfoliants. So anything that feels rough on your skin should not be used to treat your eczema-prone skin. Things that you should be using are ingredients like colloidal oats, which help to replenish and nourish that skin barrier and have a calming and soothing effect. Other ingredients to look for are ceramides and lipids, products that have proceramides that deliver the building blocks to ceramides so that your skin barrier can be nourished and rehydrated and be able to hold on to that hydration. So body washes that don't strip the moisture barrier, don't disrupt your microbiome, and also don't deliver harsh acids or chemicals or exfoliants to the skin will help with your eczema-prone skin. Now I'll list a number of examples in the comments below, but a few body washes I love especially are those by Aveeno, which contain the colloidal oat ingredient, those by Lubriderm, which contain that proceramide, which are chock full of amazing hydrating ingredients, and they even make a line for babies that help to nourish that gentle, delicate baby skin. Another type of body wash which I think can be extremely useful, but you should exercise an extreme amount of caution, is those that are oil-based. So oil-based body washes are wonderful for eczema-prone skin, again, to help replenish and nourish that moisture barrier. But oil-based body washes can be very slippery in the setting of a shower especially. So if you're going to use an oil-based body wash, it's best to put a few drops of that body wash in your bath and really soak in it for a few minutes to get the full benefit. Now that said, a few things that you should avoid using in the bath are things like bath bombs, bath salts, anything that can be extremely drying or add fragrance or unnecessary ingredients to your bath water. Now, one pro tip you might not have heard of from dermatologists is that in patients who have eczema-prone skin, especially children, we do recommend taking what we call bleach baths. And that actually serves a purpose. It's to help keep the bacterial count on the skin down. Now, this doesn't strip the microbiome, but in eczematous skin, the skin barrier is compromised. So your corneocytes are separated, there's layers and layers of dead skin and a lot of inflammation. And this is the perfect breeding ground for things like bacteria to enter. So one thing that makes eczema extremely difficult to treat is if it's what we call impetiginized, which means that it's also colonized by bacteria. So taking bleach baths, which means adding 1 capful of bleach to an entire lukewarm bathtub and having your child soak in that for a few minutes, a few times a week, this will help keep that bacterial colonization count down and thus prevent these flares of impetiginized eczema. The next thing to keep in mind is moisturizing. So after you take a bath, it's best to gently pat the skin dry and apply a moisturizer from head to toe. Now, the same ingredients that I mentioned earlier are also important to look for in moisturizers. So moisturizers should be fragrance-free, they should contain ceramides and or colloidal oat, and they should be able to deliver ingredients to help replenish that skin barrier and allow it to lock in the hydration that it needs to repair. So some excellent examples of moisturizers for eczema-prone skin are also from our favorite brands like Aveeno, CeraVe, Cetaphil, and Eucerin. I'll put some more options in the comments below as well. Now, there are 3 other things to keep in mind if you have eczema or eczema-prone skin, atopic dermatitis, itchy, rashy, sensitive skin. The first is consider adding a humidifier to your room. So either something that you can buy at the drugstore and plug in to add humidified air to the room at night, or you can actually add a humidifier to your heating system for the house to help prevent that dry air blowing when the heater is on. Humidifiers in the room also help if you're particularly prone to bloody noses in the winter, or you wake up with a really dry mouth. Humidifiers help to add moisture back into the air so that your skin and body doesn't dry out in the colder temperatures. Another thing to keep in mind for eczema-prone skin is to watch your diet. So diets rich in refined carbohydrates and foods with high glycemic indices can really put your body into a pro-inflammatory state, increasing the development of advanced glycation end products, which I have a video dedicated to entirely. So make sure you take a look at that to see what foods and what diets are best for your skin if you're eczema prone, and also what things to avoid. Lastly, with products, it's not only about your body wash and your lotion. Think about all the things that your skin is exposed to, especially if you're eczema prone. So these are products like the things you use in your laundry room. So your laundry detergent, it should be free and clear of any scents, fragrances, or dyes. And so really good examples of some brands to consider for laundry detergent are All Free and Clear, as well as Tide Free and Clear. The other things that you might use in the laundry are fabric softeners and dryer sheets. If you can avoid these entirely, that would be best. However, if you feel the need to use a fabric softener, make sure you stick to one that is, again, unscented, fragrance-free. Downy has a really nice option for that. So in summary, there are two types of eczema. There is atopic dermatitis, which tends to be genetic, autoimmune, inherited, environmental. And there is allergic contact dermatitis, which is something that you can develop by being exposed to potential allergens like hair dye, metals, and even different poisonous plants. And for all of these things, we want to make sure that we are using products that help to restore and repair our moisture barrier while maintaining the proper pH, not stripping the microbiome, and putting in our body what it needs to stay in a neutral state so that we're not causing further inflammation internally, which we can see on the outward skin. Thank you for watching this video. If you like this content, please stick with me, like and subscribe below. A new video drops every Sunday. Make sure you share with your friends, and see you next time.